Okay, everybody, so this is Dr. Zappy from the Wellness Center of Chester County again, coming to you with another video analysis, this time for a biker. So just to give you a little bit of history about this patient here, this guy has been experiencing in his right hand numbness and tingling after long rides. This guy's an avid bike rider. He rides probably about 40 to 70 miles a day. He's getting SI joint pains in both SI joints, and he is also having, at the end of his ride, post-fatigue syndrome in his right scapular area, specifically on the lower trapezius muscle. So we're going to go ahead and frame by frame this. I just wanted to give you a good look at how he's doing by himself. As you can see, there's a lot of weight shift both left and right. So let's go ahead and play this again, and we'll take it into slow motion. What I want to point out to you just in the beginning here is how stretched out this rider is. So you can see he's kind of leaning forward, putting most of his weight onto the front of the bike here. This isn't the typical position that we'd like to be in when we're riding a bike. He's actually getting a bike fitting right now. And this is actually like one of the riders. So when you typically get a bike fitting, you'll be on one of these, and the bike fit will they'll film you and then make adjustments to your bike. But what we like to do is we like to work with these fitting companies and the fitting clinics and things like that. And basically what we do is we work together to not only try and fit the bike to the rider, but to also fit the rider to the bike, because there's only so many adjustments that you can actually make. So first thing from a fitting perspective is we're going to want to try and shorten this bike a little bit, shorten him up so that he can stand up a little taller into the saddle, and we're going to also make some other adjustments to his pedal length and all kinds of different things. But for the most part, what I want to do for this video is show you the functional perspective of how this patient is actually riding on his bike. So let's go ahead and rewind it here for a little bit, and we'll get into the nitty-gritty of it. So I want you to pay attention to the right hip. The right hip is going to be a key player into this guy's condition here, and it's a matter of a lack of hip flexion. So he can't really get this knee up to a degree that we'd like to get it to. So right here at the top of the stroke, basically what we want to see is we want to see the hip be able to get to 90 degrees of flexion. So 90 degrees would be somewhere around here, and he is somewhere around here. So he's not really getting it up high enough. And when we actually take a look into another frame here, so let's just go ahead and fast forward it from a back view just to see how he's getting that flexion. Right here, he's at the top of his pedal stroke, and I wanted to show you the position of his body. Basically what he's doing is, you can tell from the pelvis here, the pelvis has a little bit of a hip hike, and he's also depressing the shoulder down this way. So you can see very clearly, even from his clothes here in the wrinkles, basically what he's doing is he's hinging through here through the low back in order to get that hip up. So the amount of hip flexion that he's even let's go ahead and rewind it again here. The amount of hip flexion that he's even getting at the top of the keep isn't completely coming from the femoroacetabular joint. It's actually a compensation pattern, which is why it's throwing everything off. It's why he's getting SI joint pain after his long rides, and it's why his shoulder is really spazzing out and giving him that lower trapezius soreness after a long ride. Let's go ahead and take a look even further. I'll address this weight issue in a little bit, but what's happening here is, from another postural perspective, let's just go ahead and draw exactly where his diaphragm would be. Is right there, and then his pelvic diaphragm is going to be in this region here. So what we have is we actually have it closing off. So we have almost what would be considered as inhibition of the front part here of his diaphragm, and he's only using maybe, I don't know, 45, maybe 60% of his diaphragm. It's not really in a good position. We want to see more extension through the thoracic spine, which will straighten him out. If we can straighten him out, basically what it'll do is it'll take his diaphragm, which is here, and once we straighten him out, it will put it into a more strategic position like that to align it properly with the pelvic diaphragm. This is not only going to allow him to use more of his diaphragm during his activation and breathing. What it's going to do is it's going to increase the capacity of his lungs and give him more of an area to breathe and get more oxygen into his thoracic cavity. So right now what he's doing, if you pay attention when he takes a breath in, it's very, very hard to see. But what he's using actually in order to get up there, since he can't use this front part of his diaphragm, he has to use the accessory muscles of inspiration, which are going to be the intercostal muscles in through here, all the muscles in between all of his ribs. He's going to have to use a lot of his upper trap muscles in here, and he's also going to use the front muscles, which would be pec minor and things, all the muscles that kind of attach to the ribs, and the muscles that are going to take the ribs into that bucket handle to increase the size of the thoracic cavity instead of using the diaphragm, which is what you're supposed to use. Another thing that I want to show to you at the bottom of the stroke here, you can very easily tell that he's so extended out. So the pedal stroke is from his heel to his hip. He can't really reach it too well, so if we can sit him a little bit further onto the seat and basically get more hip extension, just hip mobility in general, if we can get more hip extension, that will drop this down. And then when we can get more hip flexion to account for that lateral flexion that he's doing in order to get the hip up, that's going to do wonders for him. But let's go ahead and keep playing it here. And I'll show you what's going on as far as the weight shift issue. So him shifting left and right in the saddle. Let's go ahead and play it here. So in slow-mo, I just want you to get a couple frames here. And let's go ahead and bring it back. So let's go ahead and rewind it. So right here, I want to show you the left side is very straight and it's in very good position. So from the ankle all the way up to the shoulder, it's a straight line. When he comes up into flexion on the left side, it's not really the case. But what I want to show you here is that it's very stable. He's not compensating too much, and this is a good position to be in. Now, if we take a look at the other side, not necessarily the case. So let's just take it from the ankle, and we'll drop it straight up. The right shoulder here is coming way too far out from the plumb line, and that to me shows me signs of instability here on the lateral core. So if we can get him to strengthen that up a little bit and get more mobility in this right hip, he'll be able to move in a more strategic pattern than what he's doing right now. And I believe that's why most of his shoulder issues are firing to try and keep the scapula stable, and that's why he's getting too much of a pelvic tilt in the pelvis to try and get that hip up. If we can get him into a good core stability program, that'll help take care of most of that. So let's go ahead and take a look at the left side. When the left side's at the top of the keep here, you can see from the ankle up to the shoulder, it's a little bit of a better plumb line. He's not coming out nearly as far. The core here is nice and strong and everything, but what's happening is he actually has a lack of hip flexion on the left side as well. If we go ahead and take a look at the line again, what's happening is, see this knee, the knee is coming out into like an abducted position in order to get him up into that flexion posture. So in order to account for the size of his pedal arm here from the bike, what we can do is two different things. We can either shorten this arm and so that he doesn't require as much flexion, or from a manual therapist perspective, what we can do is just give him that hip flexion so that he doesn't have to externally rotate, he doesn't have to put the extra stress into his SI joints, and he wouldn't have to on the opposite side as well, which we're going to take a look at. So at the bottom of his pedal stroke on the right side, let's go ahead and see what that's doing. So here's the end, here's the top, and he's actually internally rotating on this side, so you can see that the knee is inside the line here. We don't really want that either. So not only is he internally rotating, you can almost tell that his whole body is kind of tilted a little bit to the left. He's rotating the whole body to the left. That's why that knee is coming in, and he doesn't really have the stability that he needs. You can also see from the weight shift issue, it's not necessarily that he's shifting right and then shifting left and shifting right and shifting left. What's more so happening is that he's shifting to the right and hiking this hip and depressing the shoulder. So he's shifting to the right, and then the weight shift that you see him coming back to the left is actually him just coming back to center. He actually doesn't shift over. So it's really, really a matter of that right side core stability, getting him into that right hip flexion and providing more scapular stability, which we're going to be able to see from this position here. So what we can see is if we take a line here, you can actually see the medial border of his scapula coming off the ribs. That's why you see that shadow there. And what that's doing is it's telling me that he has scapular instability, and in order to obtain the proper amount of motion in the glenohumeral joint, you have to have scapular stability. So he's at risk for all different kinds of shoulder issues because his scapulas are so unstable. And what's happening is especially on the right side, which is where he's getting pain, the thing that's giving him the amount of stability that he needs and requires to when he puts weight on that side is his inferior border of the not the inferior border, is the lower trapezius muscle. Sorry guys. So the lower trapezius is firing every time in order to get him into a good scapular position, and he's compromising all different kinds of things by doing that. So let's go ahead and take a look from a postural perspective right here. When he's in that right hip flexion, you can very clearly see here and here, it's almost like he's hinging right here through his low back. So we don't really want that. What we would like is we'd like it to look like the left side, which looks like this. Very straight, very strong, a lot of lateral core stability on the left side, not as much on the right side. So that's why he's shifting left and right. And from his history, we know that he has numbness and tingling on the right side, and I believe that's coming from the overextended posture that he has. So if we take a look back from the front here, he's so stretched out forward that it's stretching the nerve basically. So if we can shorten his posture up a little bit, drive this thoracic extension, stand him up a little bit, move him back in the saddle or move him back in the bike, just shorten his stance completely, I think that's going to do the most help for this guy. So let's go ahead and bring it back to where we were and just see if there's anything else I'd like to point out. For the most part, that's about it. Let's go ahead and take another look full speed. And if you have any questions, comments, or concerns, please leave them in the comment box. If you like the video, like, subscribe, or visit our website at wcofcc.com. Thanks for watching, and let us know what you think.